Great, I think we'll make a start. Good afternoon, everyone, and welcome to this Community Catalyst webinar. My name is Lucy Griffiths. I'm a Professor of Epidemiology based at Swansea University, and I co-lead the Community Catalyst project with Cam Broadhurst, who's at Lancaster. So our webinar series and other Catalyst activities are funded by ADR England and foundations, and through our work we've hoped to increase responsible use of the ADR flagship datasets for children's social care research. And this year, as you may have spotted, we're focusing on use of administrative data for evaluation. So today it's my pleasure to introduce Professor Lisa Holmes, based at the University of Sussex, and Professor Jenny Woodman, who's based at UCL. Their presentation will cover their recent publication, Just Because We Can Does Not Mean We Should, which offers a timely and critical perspective on increasing reliance on administrative data in evaluating complex interventions in children's social care. The paper highlights key challenges and calls for more thoughtful and responsible approaches to evaluation. And their work is therefore highly relevant to current discussions around data-driven policy and ethical evaluation in social work. So the presentation will be followed by discussion. So do please post questions in the Q&A function. And as community members, you all share an interest or expertise in children's social care research and or use of admin data. And so hopefully this will be a great opportunity for you to gain views and further insight on the challenges of using admin data for evaluation, but also opportunities for us all to improve our practice. The webinar will be recorded and that will be shared by Marie along with the slides after the webinar. Thank you all for joining, and I'll hand over to Lisa and Jenny.
Thank you very much, Lucy. Great instruction. So I'm going to share my slides and kick off. Is that looking good? Yeah.
Yes.
Okay. So thank you very much for inviting Lisa and I to talk today about really summarising our, not just our, but wider community thoughts on how we go forward using administrative data for evaluations. The basis of this talk is a paper that we've recently published in the British Journal of Social Work, which is a joint effort, very much a joint effort. You can see there all the authors listed. Today we're going to talk through the arguments in that paper with a bit more detail in three main sections. So thinking about three main challenges that we have when using administrative data for impact evaluations of complex interventions. What is the intervention? Do we know what it is? Are we measuring what matters and what is useful and interpretable? And can we construct a decent control group, comparison group? And then we'll finish with looking at ways forward and a bit of reflection, which hopefully will lead into a nice discussion afterwards. This paper has come from our Children's Social Care Data User Group network, which is a knowledge exchange network that Lisa, I and Nikki Luke at Oxford established in early 2018, really coming out of a need that we felt, but also others felt, for a knowledge exchange group that could share learning about how we use and interpret, how we analyse, use and interpret administrative data from children's social care. So at that time there was a version of that knowledge exchange network for the education data, the national.
Jenny, sorry, yeah. Can I interrupt you?
Yes.
The sound, I don't know whether it's the fan on your computer cooling down, but the sound, we can hear you, but there's some background noise, and someone just put up their hand up, so I don't know whether that was a related point. Yes.
Okay. Okay, any better?
It's still there, but maybe if you speak slightly louder.
Sorry, 1 second, hang on. Okay, is that any better?
No, it's still there, but I think that should we keep going?
We could, Lisa, sorry to put you on the
I was
spot,
just
but
about to say, do you
you
want
could
me to
take
take
over for this
over?
bit and I'll try, go away and try and fix my sound and then I'll come back. Sorry.
Yeah, the only
That's
thing is
great.
that because Jenny's sharing, I will need you to move on the slide.
Yeah. Okay, got it.
But yeah, I'll pick up the yeah, apologies everybody. So hopefully I can just step in here. So as Jenny was saying, the background to this British Journal of Social Work paper, it was developed as part of our Children's Social Care Data User Group. And Jenny's just introduced us, and when we were set up, we now have around about 200 members. And so sort of developing quite the community. I'm going to ask if Jenny can move on to the next slide. Thank you, Jenny. So in terms of this paper, back in 2024, we ran 2 webinars as part of the Children's Social Care Data User Group. And the community at that time had asked us to focus on evaluation in children's social care. And the 2 webinars were split. So the first was focusing on the uses of national administrative data, and the second was focused on the uses of linked local data. So looking at both the national data sets and the local data sets. And the rationale for setting up these webinars and opening up these discussions was against the backdrop that you will, I'm sure, as the audience here today, will all be very familiar with in terms of an increasing number of impact evaluations across children's social care that were reporting no evidence that the intervention had improved outcomes for children and families. We'd also seen an increase in the number of evaluations that were relying primarily on administrative data rather than taking a mixed methods approach. And as you will be familiar with, and there's been a concerted effort to focus on administrative data linkage and increased use of administrative data for research and evaluation, which I should just say as a bit of a disclaimer that we're broadly in support of. But what we're trying to do here is highlight some of the issues that came through those 2 webinars. We then opened up to the wider community to say that we wanted to pick up on the key themes that had been introduced in those webinars to then see about actually producing a critical commentary, setting out those overarching points. That went out to all members of the data user group, and we ended up with an author team of 8, including myself and Jenny. Next slide, please, Jenny. Okay, so this was where I was going to pick up anyway, and then hopefully for the latter part, Jenny will be all sorted and can come in with some good audio quality. So as Jenny did say at the start, for those of you that were able to catch it, is that within the paper, we've identified 3 overarching challenges. And as you'll see, as we start to talk through them today, they are interlinked. They are not entirely separate challenges. But also within the paper and what we're talking about today, we're trying to provide some examples and some solutions. So this isn't just about stating the problems. So Jenny, next slide, please, for the first of the 3 challenges. Okay, so our first is focused on what is the intervention. And as part of this challenge, we have 4 underpinning themes that I'm just going to talk you through. So again, what we have seen in children's social care is that quite often there isn't an underpinning program theory that exists, or it isn't necessarily explicit. And the degree to which theory of change and program theory has been used prior to evaluation is hugely variable. So again, here we're using the example of family group conferencing, which is an intervention that many of you will be familiar with across children's social care that is embedded in program theory. So there's a clear program theory for family group conferencing. But then again, as you start to look at the evidence associated with family group conferencing, there are mixed results from different evaluations. So again, raises a whole range of complex and interconnected issues. So in terms of the development of the program theory or theory of change, it also raises questions about the integration and timing of process evaluations. So trying to think about, has the program theory been developed, if it exists? Has it been developed in isolation from the evaluation, or has the evaluation been thought about and integrated into that process right at the outset? Again, drawing on some of the examples that we include in the paper, we talk about multi-agency safeguarding hubs, where actually there was an impact evaluation that was underway, and it was through conducting the impact evaluation that it was identified that there wasn't this clear program theory that was underpinning the work, and so as such, the way in which the intervention was being implemented was hugely variable. And it then led to a separate process evaluation and theory building happening in parallel. So moving on to that, in terms of the intervention as implemented, again, through the process of our 2 webinars and then the subsequent work that we did to develop the paper, what we identified was huge variability in implementation. And again, highlighting some of these issues here in terms of timescales, eligibility. So again, even where eligibility criteria might be clearly defined as part of the development of the program theory, that isn't necessarily always operationalized as part of the implementation. And similarly, fidelity. So again, there might be clear theory of change or program theory, but the ways in which that gets implemented locally doesn't necessarily reflect what was originally intended. Again, using signs of safety as an example here, again, another intervention in children's social care, used internationally, has the underpinning program theory, but then the evaluations of signs of safety identified that the ways in which it had been operationalized and implemented is that quite often there were elements of signs of safety, usually related to the toolkit, rather than the underpinning changes in practice that were driving the implementation. So they're the first 2 of our sub-themes, the intervention in theory, and then the way in which the intervention is implemented. Next slide, please, Jenny. Okay, so continuing with this theme of our first challenge of what is the intervention, there was also a range of evaluations that identified that as the intervention was being implemented, that questions were being asked around, isn't this just good social work practice? Isn't this what we should be doing, but we're not able to do because of pressures on the service? We also saw through the literature as well is that quite often when interventions or programs or models, however we want to refer to them, were being implemented, is that the business as usual, so the practice as usual, didn't necessarily remain the same. Often it was evolving or it became enhanced as part of the implementation. So again, really important that in any evaluations, we are thinking about and understanding how the intervention is being implemented and how it's being how it is evolving and how practice as usual is evolving. Again, drawing on signs of safety here, what we could see was that hugely sort of difference in terms of the ways in which it was implemented, and quite often through the qualitative elements of those evaluations, what they were learning, the evaluation team, such as Mary Baginski and colleagues, was this feedback that actually what we're being asked to do with the implementation of signs of safety is just good social work practice. So the last underpinning sort of theme around this challenge is about the data recording and collection. So even if you have got really good underpinning program theory, that there is fidelity to the model, the ways in which it's being implemented are clearly defined, that there are clear criteria for referral, is that quite often, or in the most part, it is not included in the administrative data sets which children and families have received an intervention. So we don't necessarily know through the administrative data where an intervention has been introduced, where it's been implemented, and who has received it. And again, Jenny's going to come on to this in a bit more detail when we talk about the comparison groups. But we also, when we're talking about the administrative data and when a secondary analysis of the administrative data is being used for evaluation, is really thinking about whether the analysis is happening at an individual or an aggregate level. So whether it's about looking at the experiences of individual children and families, or comparing local authorities. So local authorities that have implemented an intervention with local authorities that haven't. We also need to think about, okay, so we have the administrative data and thinking about the flow of administrative data. So again, I'm sure that everybody who is on this webinar will be very aware that when we access administrative data, either through SAIL Databank or through the ONS Secure Research Service, that data is made available to researchers. But the origins of that data is within local authorities. And local authorities prepare those files, but they also have a whole range of other pieces of information and data that is held locally. And so again, that opens up these questions around how and where is information recorded locally about who has received an intervention. And what we have seen is that there are some examples of using flags or custom fields locally. So within their administrative data sets, as they are positioned within management information systems, within some interventions and some local authorities, we have seen the introduction of flags, so you can see who has received an intervention, or the creation of custom fields. And just to wrap up this first challenge, I'm just going to provide you with an example of lifelong links, which is an evaluation that I have been doing on behalf of family rights groups since they first implemented lifelong links around about 10 years ago. Jenny, next slide, please. Okay, so I'm not going to spend lots of time going through this, but I just wanted to highlight how, again, when we're trying to think about what information exists and can be used locally, that can be linked to administrative data sets, which is exactly what we did with the lifelong links evaluation, is that even where with lifelong links, there is a very clear process of the different stages so that we could capture this at an individual child level. And we thought that we had produced very clear guidelines for local authorities to capture each of these stages in the model. Is it was only through going through that process of developing the custom fields with local authorities that actually the ways in which each of these stages was operationalized was still variable between local authorities. So again, just including it here as even as researchers and evaluators, as we're trying to look at solutions, is really just trying to highlight the amount of consideration that is needed to think about how do we capture exactly how children and or families are receiving an intervention, and how do we make sure that that is recorded systematically within each local authority before we can even get to a point of potentially linking it then with administrative data sets. So I'm just going to leave that first challenge there and move on to our second challenge. So next slide, please, Jenny. Okay, so our next challenge that we really wanted to highlight and is central in the paper is, are we measuring what matters? So again, as I've already said, these challenges are not entirely separate. It comes back to program theory and theory of change. But also when we're thinking about the outcomes that are being measured in evaluations, is really questioning for ourselves and individually and as a community is, what decisions are driving the included outcomes? And is that about availability of data? So our outcomes, even if we have a theory of change, are the outcomes that are being defined based on those that can be counted and measured and or are in the administrative data rather than how it is experienced. Again, just thinking about who is making those decisions around what outcomes. Does that include any views or experiences of children and families? Are we measuring what we can measure because it exists, or are we measuring what matters to children and families? Again, raises lots of questions about what are the right outcomes, and also how do we interpret changes? Again, we see with the existing demand measures, within the children's social care data sets, there's a lot of discussion and a lot of use of repeat referrals, for example, or numbers of children coming into out-of-home care. Again, that raises question about how do we interpret those changes and how do we actually link the activities in the theory of change to those outcomes. Again, just trying to make sure that we're balancing the discussion today with some potential solutions is what we draw on in the paper is examples from adult social care where there are standardized toolkits of social care outcomes with users of adult social care, which are focused on satisfaction with services. And whilst they are not linked with administrative data, there is that as an example there of something that is routinely used to capture satisfaction with services that brings an additional dimension into the data sets. Also thinking about uses of cohort studies, and we do have some really good cohort studies in England and across the UK. And again, using the example of Born in Bradford, and obviously Lucy is chairing the session today. There is now the new funding for the new generation, new era, which is going to, as we move forward, give us a new cohort study. So next slide, please, Jenny, as I wrap up this challenge. Okay. So when we've been talking and thinking about measuring what matters, when we're thinking about different outcomes, a key aspect of this has also been considering the linking of administrative data sets. So not just thinking about children's social care data sets in isolation, but again, I'm sure that all or most of you will be aware that through ADR UK and other initiatives, although mainly ADR UK, we have seen more and more linking of administrative data sets at the national level. We've seen the introduction of flagship data sets, which is really, really helpful. But again, just thinking about as we are doing that, does that help us to move forward with some of the issues we've already raised about are we measuring what matters to children and families? What is in those administrative data sets that we can use well, but also recognizing that there are a range of different variables that don't exist, even if we continue to link across other administrative data sets. So really trying to think about, it helps to move us to a more holistic view because we start to understand the interaction of children and or families with a range of different services. It helps with longitudinal perspectives, and it helps for the local authority analysis. So again, just drawing on the last example before I hand over to Jenny, is Michael Saunders and colleagues at King's College London had done a really, I think it's a really lovely analysis of local authority level data, looking at outcomes associated with care leavers and their homelessness. So I'm hoping, Jenny, that your sound quality is resolved and I can hand back over.
I was a bit limited by sharing my screen. I couldn't do anything. Can you hear me better now? Or not yet? Because I have another fix I can try.
I'm not sure it is. There's a
Okay.
It sounds like a background fan, Jenny.
Yeah, sorry about this. I couldn't do much because I was sharing my screen. I'm going to stop sharing my screen and I'm going to do what I would like to.
Okay. So Lucy, I'm just going to move and I'm going to share my screen so that I can have my slide showing. Apologies, everybody.
Okay, how does this sound? Is that any better? That's better. Okay, sorry, I couldn't do that before because I was sharing my screen. Okay.
Jenny, do you want me to take over sharing then?
Yes, you do the sharing now. Sorry, coxing and boxing. Thank you for being patient.
Oh, goodness. I feel like my technical skills are being pushed to the limit.
Well,
so is that showing in presenter mode?
no.
Is it
You're
okay?
all good. You're all good, Jenny. Elisa, yeah.
Okay, we're all good. Okay. So.
Okay, there we are.
Great. All right. Let's try again. So, thank you, Lisa, for stepping in. So, the next challenge is the comparison group, and particularly the issue of residual confounding. So I'm going to talk through an example from health visiting, which is mentioned in our paper. And the analyses I'm talking about were not done by me, so they're conducted by Catherine Bunting and Katie Hallen led this part of our study. So just in case people don't know, health visiting is a public health service. It's our universal public health service for the under fives in England. It's not a children's social care intervention, but it is relevant to children's social care because we know from qualitative work that much of health visiting is for safeguarding concerns. So it's preventive and child protection. It's funded, health visiting is funded by the local authority through the public health grant, but staffed by largely NHS employees. Two more important points about health visiting that you need to know. One, every child in England should, in theory, by policy, have 5 mandated contacts before the age of 3. Additionally, when need is identified at those contacts or otherwise, the health visiting team can give additional contacts. So the aim of this study was to evaluate health visiting and specifically evaluate enhanced health visiting, which was receipt of those additional contacts. Initiated within 30 days of the first mandated contact. So this is a study that uses individual level data. There are also different ways of creating comparison groups. It can be at the area level, but this one is an individual level study. The health visiting contacts are captured in the community services data set. So that's the data source. It's very problematic. It's very incomplete. So we have that to deal with as well. We use a target trial design. So babies born 2016 to 19 in just 10 local authorities, which was the most complete data we had. And our primary outcome was avoidable hospital admissions within the first year of life, so the babies. And so for things like jaundice, gastroenteritis, feeding difficulties, so common health problems in early childhood. Our hypothesis for this study was that the more health visiting you had, so if you received the enhanced offer in the early weeks of your child's life, that would build the capacity of families to manage those common illnesses in their children and prevent hospital admissions. But the problem is here that the characteristics of families that trigger the enhanced health visiting are the same characteristics that might make families more children more at risk of the hospital admissions. Such as deprivation or family adversity or early health problems. So that's where we run into problems of compounding. We created the comparison groups in this study using propensity score matching. And next slide, please. Propensity score matching, trying to create groups of treatment and control that were similar with respect to the child's maternal history and pregnancy and birth, as you can see here in this table. And it was quite a long list of codes in the administrative data that we matched on. You can see particularly that we tried to match on social factors as well as health factors. So you've got there in the maternal history, you've got maternal hospital use for mental health violence, substance misuse, as well as health problems. So we used logistic regression to estimate each child's propensity to start to initiate enhanced for health visiting within 30 days of their first contact with the service, given these measured confounders. And what we found here in blue on the slide is that the intervention group, so the babies with the enhanced health visiting, were 28% more likely to have one of those avoidable hospital admissions. So that's not what we were expecting. We were hyping, hypothesizing that it would be the other way around. So the question here is, how do we interpret that? So increased risk of the outcome in the intervention group. First, I think we need to consider that it might be true, it might be accurate and correct that more health visiting leads to more hospital admissions. It's plausible. It could be that families become more confident using services and then end up taking the child to hospital and get admitted. It could be that some health visiting staff, especially those who are less qualified or experienced, might encourage children in hospital for minor conditions. Or it might be that parents who are requesting additional contacts from the service are the ones more likely to take their child to hospital and then result in an admission. The thing here that's important is that we are not completely sure that increased admissions are bad. They may represent appropriate healthcare use. It might have been that those children would have otherwise should have gone to hospital, because with babies it's better safe than sorry sometimes, and they need to be observed. They should have gone to hospital, but they didn't. They wouldn't have had that admission, that hospital use, if they hadn't had the health listing. Secondly, so that's, but we have a problem with an outcome that is difficult to interpret, one. Secondly, have we created a decent comparison group? Probably not. So although we matched on all these factors in the administrative data, there were lots of other things that the health visitors told us in the qualitative part that they were using to trigger an enhanced health listing. Things like social isolation. So is this a family that's surrounded by helpful wider networks, or are they completely on their own with no friends or family? And we cannot, and that will also influence hospital admissions, managing the child's health condition in hospital admissions, and we can't measure that in the administrative data. So with all this uncertainty around how we interpret the outcome and whether we have, in fact, what we've actually found is that we've created an intervention group that is more likely to have the outcome anyway. So we found that they have the outcome. With all that uncertainty, how do we present those results to policy colleagues? So this study was commissioned by the Department of Health and Social Care through the NMHR Policy Research Programme. So it was it was the NMHR that put a call out for this type of study, and then we answered. So policy colleagues were waiting for the answer on this evaluation to inform their submission to the spending review, as they are with many studies. And I think if we report this in a very standard way, as you know, in the way that I have just done, there is a risk that it will be interpreted as health listing doesn't work. Even if policy colleagues and commissioners understand, as I think they do, the nuances of the study, it's really hard to safeguard resource for interventions that have been evaluated but have not been found to have a positive effect, even if you know it's probably methodological. So what we did in this case was we reported that our methods were insufficiently robust to report the results, and we treated it as a methodological study and reported it that way. So I'd welcome comments and discussion on that later. Next slide, please. Thank you. So we've been thinking about ways forward, and we do that in the paper. So one is to do and fund programme theory first, so not at the same time as you are doing the evaluation first, and perhaps as its own endeavour. So to fund qualitative programme theory studies so that evaluations can be more quickly springboarded from them when they're needed, and not trying to do everything at the same time to a policy window. Robust consideration of limitations at planning stage. I mean, it sounds obvious, but it requires quite a lot of often funded time to think through, is our outcome interpretable? Do we know what it means? Definitely if it goes up or down, because that's pretty key. And then what do we need to account for a good comparison group? And that should be done through qualitative work, where you look at, you know, what factors are associated with getting the intervention or not, and the outcome. One idea that we've been thinking about is prospective data capture. So rather than looking at things that are, you know, relying on already collected administrative data, do a prospective study. So you use the routine administrative data, but you could also combine it with new data that you collect as you go along on the intervention, on the family characteristics, and on the outcomes. Another possibility there is to link to cohort data, as Lisa said. Although I think that's I think that's part of the solution, probably not all of it. Obviously, as Lisa said, we need to collect the views and experiences of children, families, and practitioners, and where we encourage mixed methods. And then I just had, next slide, please, some final reflections, which are, I think, so all of those ways forward are we're not the first to say them. They perhaps sound quite obvious, and they are things we can all agree with, but I think to do those things would probably require a change in the ask from government and funders, and maybe a change in the way we respond to that ask, because the funding calls that we see, and I've seen some this month, do not facilitate that kind of research. And I'll leave you to watch that YouTube video where Katie, Hammond and I are discussing some of the challenges at the beginning of the study, because we thought we would have a go. We've learned a lot since then. So we've got time now for some discussion, and I'd really welcome particularly some discussion about how we might work as a sector, as a collective, to really maybe change the ask from government and funders and the way we respond to their policy needs.
Brilliant. Thank you both. Really interesting talk, and I think important as well, a reminder of the challenges around using admin data for evaluation. So we've got some questions in the Q&A, but I think because Jenny and Lisa have invited discussion, if you'd like me to unmute your mic as well, you can have a chat with Jenny and Lisa too. So Sandra's asked, does data collected include costs? So I'm not sure whether this is specific. Sandra, do you mean admin data, or did you want to sort of expand on that? Whilst, I mean,
I'm happy to answer that, Grace. So actually within the SRS and the administrative data, we don't have data on costs or expenditure of children's social care. So there is data about expenditure on children's social care at the individual local authority level as part of the Section 251 return, but that is done at a very high level. So it will be a unit cost for a child in care broken down by different placement types, or a unit cost for child in need services. But within the administrative data, there isn't the detail in terms of the different costs associated with different interventions or the unit costs of different ways of operating children's social care practice. Hopefully that answers your question, Sandra.
Brilliant. So then there's another question from Anonymous. Are there any common local authority measures of child or family satisfaction within support or services?
Lisa?
I was going to say you were nodding as well, but
I was nodding thinking this was one for Lisa.
Okay, no, that's fine. So yeah, I don't know if I'd necessarily describe them as common, but there are a range of different local authority child and family measures. Sorry, I'm going to switch. I've got the Q&A up, and I'm going to get rid of it because it's distracting. So for children in care and care leavers, I'm sure that many people on the call will be familiar with Bright Spots, which gives us, it's not necessarily a satisfaction measure, but it's a way in which capturing information from children in care and care leavers within local authorities about their subjective well-being. In terms of child and family satisfaction, there are a range of different measures. I'm just thinking about some of the ones that I've come across, probably the most in the range of different studies. So Outcome Star tends to be used by a number of local authorities, where that can be used for children and also for families. Again, thinking about for children, there is Mind of My Own. So there's just a few examples. So there are local authorities that are using a range of different satisfaction measures, but they aren't linked with administrative data, and they're not necessarily the same in all local authorities.
Brilliant. And are you aware of any longitudinal research which has looked at health visiting extra contacts and potentially SEND support or extra targeted interventions later in a child's life, potentially which is turned into an EHCP?
Thank you, good question. I don't think that's been done. I think it would be subject to the same types of problems as we've just seen. So the reasons that you might get more health visiting are the same reasons that you might end up with special educational needs and disability support, in whether that's in the HCP or being on the same register. So it hasn't been done. I think it's really important to try and think about the role of health visiting for supporting families with SEND. But I'm not sure this retrospective quasi-experimental design would be able to do that for the reasons we've gone through. Maybe prospective, maybe linked to cohorts.
How feasible is it to ask local authorities to complete custom fields on who have received or who hasn't received a service?
Do you want me to start on that one, Jenny? Because it's something that we have done it for lifelong links. We incorporated it as part of the evaluation and as part of local authorities being funded to implement. So this was when we did this, it was part of the Department for Education Children's Social Care Innovation Programme. So I think asking local authorities to do additional data collection, whether it doesn't have value for them, is really problematic. So what we had done with Lifelong Links, initially local authorities were funded to implement the programme, and we included that as part of what they were required to do. What we've also focused on is making sure that the ways in which we're asking local authorities to capture data for custom fields is that it's then information that they can use for their own sustainability and business planning. So again, I think for me, it's an example where if we are asking local authorities to do this, then there has to be value for them, rather than it just be about the external evaluation. So I think that's something, again, I would say as researchers and evaluators, we have to bear in mind that if we are asking more of local authorities or other organisations, that we actually are considering what is the added value for them and how can we develop something that can be multifaceted so it has longevity beyond the lifetime of the evaluation as well.
Great, thank you. Sandra has come back with a question RE costs. So I'm just gonna, Sandra, I've unmuted you if you would like to speak.
Can you hear me?
Yes.
Yeah. Oh, sorry to bang on. Yes, I'm sorry. I was fiddling around with trying to find how to do things on the screen, so I didn't fully hear Lisa's comment around collection of costs. So I wondered if she could either restate or put it in the chat, please. Be very grateful. I mean, of course, it's a huge consideration, isn't it?
Yeah, absolutely. So I'll just summarize, and I'm happy to follow up, Sandra. I'm just aware of time. But so within the secure research service, where many researchers and evaluators access the administrative data, there isn't any cost data, but the cost data for children's social care sits separately within the section 251 expenditure outturn, which does provide a detailed breakdown of costs at individual local authorities and nationally, but not for individual programs or individual services. It's done at a very high level. So for example, for different placements for children in care, and then also for children in need. So I'll just leave it there, just in case there's other questions we want to answer, but happy to have a follow-up, Sandra, if helpful.
Thank you, that would be helpful.
Thank you. So I think we've probably got time for one more question. So there's a question at the end, you mentioned which a bit about funders and how they can maybe think about their calls and what they're asking for. So there's a question about how funders can improve the commissioning of evaluations. So do you mean things like including development of TOCs, IPEs to assess fidelity to the models, etc.?
Can I go first, Lisa? So I think this is something, it's a good question, Vicky. I think it's something we need to work out as a sector. So to have a conversation with the policy colleagues that are at the evidence needs, with the funders and with the people who will supply the research together. But my first thoughts on that are, I think the speed at which evaluations are expected to occur is a major stumbling block here. So, for example, that health visiting study that I described was a 2-year study, and it was £500,000, which is for a research study not that much those days. So, and that was that was unmovable because of the policy window for the spending review. And it just really, really limits what you can do. So with that said, we found out, I thought, so much policy relevant material about how the service is delivered that did inform policy, but we didn't do what they needed, which was the impact evaluation. So I think it's perhaps accepting that we cannot do these things really. So administrative data is not the solution for doing these things super quickly always. That they might have to be a little bit longer. So there's that. And then I think there's maybe the dual track funding. So to fund as standard, exactly what you're saying. So program theory or impact and process evaluations as standard separate from evaluations. So when policies are rolled out, let's look at what's going on in theory and practice. And then when you need an evaluation, you can springboard from that maybe in 2 years, because that work would have already been done. So they're my first two ideas. Lisa?
Sorry, I've just failed at multitasking. I was just putting a paper in the chat, so I'm not sure that I would have anything meaningful to add to that.
But I'd be really happy to have more conversations with anyone who is commissioning research about what this, what it might look like as we go forward. Because we don't want to keep reproducing studies that have no evidence of effect. And we're slightly conflicted, I think, as researchers, because we want to do work in areas that interest us. And that's what the research commissioning is saying we can do. Even if we feel very wobbly on the evaluation bit, there's a bit of incentive there to go ahead and have a go, because you want to do the descriptive work in the end.
Jenny, thank you, Lisa. And thank you to everyone for attending. Just in the essence of time, I'm going to wrap up quite quickly. Thank you for just a really insightful discussion, and I'm sorry if we missed or didn't get to all of your questions. Perhaps Lisa and Jenny could just have a look and type any remaining answers. Just take a moment, if you would please, just to fill out our evaluation Q&R code. Marie will put it on the screen now. And if you do have any evaluations that you're involved in yourselves and you'd like the Community Catalyst to host a webinar for you, please do get in touch with us via Marie, and I think you will have her email address. So thank you for attending. Sorry for any technical issues today, but I hope you all got something out of it. Thank you. Bye-bye.